Hey, welcome everyone. LCC Massage Therapy. My name is Patrick Taylor. We're going to be doing a little event massage review, consideration for a pre-event, sporting event. Say it's a race, say you're going to some 5K or some triathlon. Our athlete here is getting ready to participate in her event. She has done a warm-up. She's getting ready for this race. So she's coming to us for a 10-minute or so pre-event massage. The idea of this is to invigorate, not to make her sleepy, but to keep her body moving, increase the fluid movement of the tissues, her perception of her joints, trying to make everything loose and mobile as possible. So first, of course, we want to center, being quiet in yourself. We're going to approach the athlete and just start this basic connection, one hand on sacrum. We talk a lot about this rock. Once I create a little bit of this flow, each individual client will have kind of their own oscillation. Once I match what that flow, that vibration, that oscillation feels like, I want to try to keep it throughout this massage. So now that we got things moving, I'm going to pick on her legs first, transitioning down to this leg. We'll call this superficial friction, where I'm just doing a light engagement of the leg. I have my top hand here bracing the hip so that my mechanics stay clean, and I have just a little bit of a brace. Working through the thigh. I'm going to work down, two hands toward the leg. Again, using that superficial friction through the calf, through the thigh, through the hip. Working up and down the leg 3 times, maybe 4, depending on how quick you move. Once I get down for my last run, working back to the leg, I'm going to give this leg a little traction. So scoop the foot, brace with the ankle, it makes a nice handle. I'm going to give the leg some traction, a little shake, then decompress, traction. Ooh, little ankle crack, nice. And decompress. One more time. Now, if I felt like she needed more deep work, let's say she does, I'm going to work deeper compressions or a compression and a twist. Trying to use my body weight, dropping my legs into it. If I start to get fatigued at all with my palm, I can rotate to my fist. See, this leg feels particularly tight along this lateral line, so we'll give it just a cycle or 2 of this deeper compressionary work. Trying to loosen that up just a little bit more. And then we'll end at the leg again, kind of shaking that up. This is our transition. So once we get to here, we can even just hold that leg in traction as we decide where to go next. Leg traction and shake. Now we're going to go to our range of motion. I transition, step through, bend the knee. We're catching the toes almost on my bicep tendon. Hug the ankle. Now I have good mobility. I'm going to stabilize her knee and take her through that soleus stretch 2 or 3 times towards the head and back. Transition quad stretch. Heel towards the glute. Heel towards the glute, a little shake, 3rd time. Now this hip stretch, medial ladder with the hip. I love having my hand right on the glute insertion, trochanter of the hip. That is almost what pushes this leg back. Take the leg across, compress, the leg pops right back towards you. I can move up and down that lateral hip, and it's a nice way to traction to the side. Couple ones here. We bring this leg down. Give it a little shake. Go to both sides. Keep my wiggle. This is my transition to the other leg. And then I'm on the other side. Same idea. Superficial friction, up and down, 2 to 3 times. Up into the hip. This is my brace arm. So I kind of get this work a long way from me. Brace into the table if I need it. A couple minutes into it, your heart rate starts to get up. You start breathing a little bit. Make sure head stays up. We don't want to dive into the table and lose our posture. Keep your breath. Almost as much to remind me as to remind you to keep my breath going. One more time with our superficial friction. from the top of the hip, through the leg, down again, scoop the foot, trap the heel, little pull, little release, traction and shake, one more. This hip didn't feel as tight, but I'm just going to do just one round of compressionary work to keep her even. If you decide that something is quite tight and you feel like you need to work deeper, work in, but also then transition back out, so we're not just leaving that muscle heavily compressed. So you'll see that little work in, work out. If you're going deep, make sure you just work your way back out. And again, wiggle and transition, leg shake. Next, we're going to transition to the side. So I'm going to take my step, scoop that leg out, and I feel like I'm a little far, so I'm going to cheat her leg out just a little bit so it's easier to get to. Mechanics are good. Trapped her arm, stabilizing the knee or mid-thigh so I have somewhere to go. Lunge forward, stretching the calf and soleus, stretching the calf and soleus. More. Let's give that a little shake out. Back to the quad stretch. Step, step. Into the stretch. Opens it up. Again, not challenging anything. Just mobilizing. One more for good measure. Plant the hip. Rotation of the hip, medial and lateral. Push it across. Compress the hip and boom, comes right back. Hip compression does the work. More. And again, transitioning off of the hip. I'll come down. Nice leg shake. I'd set it down. Maybe a finishing stroke, maybe just a little traction, and then we'll make our way up to the torso. So transition up to the torso. Just like I started, back on the sacrum. Refining the rock with some rocking. Now, paraspinals are the key. Superficial friction. We can use the palms, ball of hand, thumb edge, whatever feels good. You'll see me get up, especially with this looser shirt. I kind of bog down using my fingers, so I'll use that palm. Reaching to the other side. I don't like diving over the table. You'll see me kind of square up. My short arms need to reach to the far side. Up and down, working those paraspinals. 2 to 3 times each side. I got one more. Yeah. Now, sacral stretch. Having one hand push one way, having the other push the other way. We can do this, but I really like the crisscross. It allows me to use my body weight to push her ribs away from the hips, but not in a relaxing kind of way, more in an energizing, quick motion. I'll usually do about 3 pumps per cycle, near side, on the spine, far side and back. Let's do one more round. Excellent. Transitioning back up. Now here I call it mitten squeeze. I've heard of pincer grip. We want to work the area around the neck and traps. So squeeze you like you've got winter mittens. I don't want to dig in my fingers. And I want to use the big compression muscles from my shoulders leaning down into this technique, working from the outside of the shoulder, AC joint, glenohumeral, up through traps. I'm going to bring in this right hand to work on the neck itself. That gets a little far for me without transitioning sides, so I'll probably do that in a second. Finishing up this side. Working around the shoulder, getting the neck transition. Back to mittens on this side. Shoulder grip. Conveniently, it makes it nice. You can work right out to the shoulder cap from here. Shoulders, shoulders, shoulders. Traps down in the mid-back. And again, I'll bring it back with maybe this light stroke, maybe some percussions. I feel like a little choppy choppy. Or that vibration. If she looks like she might be getting sleepy, I'll make sure we wake you up. And that concludes this side of the body. I'll ask you to flip over and we'll begin part 2.